and my dear colleagues. In the 2020s, we all witnessed the COVID pandemic, where our travel routes were tracked, we were covered in PPE kits, and today let's have a recap. Back in the 1980s, a mysterious critical illness named AIDS was being diagnosed, and those who were diagnosed with AIDS were venomously attacked by the mob, both physically and mentally. Their houses were vandalized, they were criticized, and they were judged for being and acclaimed as homophobes. We are all well aware of the phrase fight, flight, and fright. It is all about people who flee. But today, let us discuss about someone who chose to stay and fight against the fright, and that is White. We are all aware of the movie name The Curious Case of Benjamin Button. And today, let's see the serious cause of Ryan White. Ryan White, just like us, was a teenager. And like us, he also wished for a proper school education where he can study well, he can have friends around him, he can study with his friends together, but he was barred from attending a school just because he was an HIV positive individual. And how did he get this HIV? He was already diagnosed with hemophilia. Back then, hemophilia was a critical illness in which people were actually suffering until they pooled the blood and started transfusions. And due to this unscreened transfusion, Ryan White got the HIV infection. And he was barred by the school from attending the classes. Now we are all aware of the telecommunication innovations in which we all had our Zoom classes, we all had online classes. But back in 1980s, can you imagine a student was studying through telecommunication using a phone, he was attending a class. So he and his family was determined enough to fight this discrimination, and luckily, and also because of the uphellment of law, he was allowed by the court to attend the school. This is not a single occurrence. Even in Kerala, we know about Blessed and Blessy who were denied school admission just because the mob was paranoid. The then minister, Sushma Swaraj, came to their house and met them in person to show that it is not the person who is positive with an infection which is dangerous, it is the infection against which we need to fight. And this World AIDS Day, the 35th World AIDS Day, the motto is remember and commit. What should we remember? We should remember all those people who are actually fighting this deadly evil HIV infection in various arenas. Some got this through transmission, some might have got through a shared needle, and in so many ways. But in one way or the other, we should have a commitment towards those people who are suffering with HIV infection. Globally, 39 million people are now living with HIV. In India, 2.5 million people are living with HIV. This is the state-wise statistics of HIV infection, people who are living with HIV, and Maharashtra, Andhra Pradesh, and Karnataka states tops the list. What is HIV? HIV is actually human immunodeficiency virus, which has two strains, HIV-1 and HIV-2, in which the HIV-1 is more common, and that is an infection that attacks the body's immune system. And AIDS, which is acquired immunodeficiency syndrome, is the most advanced stage of this disease. HIV virus targets the white blood cells, especially the CD4 T cells, and reduce their number. And WHO, the World Health Organization, defines advanced HIV disease as CD4 cell count less than 200, or WHO stage 3 or 4 in adults and adolescents. All children with HIV younger than 5 years of age are considered to have advanced HIV disease. Why is it so important that we should actually dedicate a day for HIV or AIDS? Why is it so important? It is very important because of the stigma. Being discriminated in your own home, in your own village, amongst your own people is nothing but a nightmare. And people who are living with HIV is really facing the situation in their day-to-day lives. And as you all know, there are no miracles and no cure for HIV. When should a healthcare worker suspect an HIV infection? Mostly the people who are HIV positive, they have an immunocompromised stature. Because of that, they are prone to multiple infections. Significant weight loss can be there. Due to their reduced immunity, very rare specific diseases pertaining to HIV can be seen in them. The common manifestations are fever, chills, joint pain, fatigue, and all appear to be a flu-like situation. The common manifestation of AIDS, that is in the later stage, it shows extreme weight loss, lymphadenopathy, Kaposi sarcoma, candidiasis of mouth, toxoplasmosis, pneumocystis jirovecii pneumonia infection, primary CNS lymphoma, oral hairy leukoplakia, candidiasis, etc. Based on the clinical severity, it is divided into 4 categories. The initial infection, which we have already discussed, which is a flu-like syndrome, and then an asymptomatic carrier state, which can even go up to 10 years, where the person who is HIV positive is not symptomatic and she or his family doesn't know that he is having an HIV infection. And then comes the AIDS-related complex, and then the final stage, which is AIDS, acute immunodeficiency syndrome. The disease spreads more easily in the first few months after a person is infected, but the symptoms of HIV vary depending on the stage of infection. How? After the main question, what and when, the most important arena which we should discuss about HIV is how is it being spread. As you know, the usage of drugs is on a spree in Kerala, in India, in all those places which we are actually accustomed to. So, government and non-government organizations are coming up with so many programs to combat the drug abuse. And this sharing of needle habit can actually be a cause for transmission of HIV. The unmonitored blood transfusion, sexual contact, and vertical transmission, which is the transmission of an infection from the mother to the fetus, can also happen. And HIV is transmitted by exchange of a variety of body fluids from people living with HIV, such as blood, breast milk, vaginal secretions. And HIV can also be transmitted during pregnancy and also during the delivery of the child. It is important to note that people with HIV who are actually taking ART, that is antiretroviral therapy, they have an undetectable viral load and they do not transmit HIV to their sexual partners. So early access to ART and support is very critical in the treatment of HIV. How is it diagnosed? ELISA is the screening test, Western blot is the confirmatory test, and polymerase chain reaction is used as confirmatory test and to assess the viral load. In India, the testing is done in integrated counseling and testing center where the confidentiality is guaranteed, and it is happening in district hospitals and also in medical colleges. Treatment actually includes 2 NRTI, that is nucleoside or nucleotide reverse transcriptase inhibitors, plus one NNRTI, that is non-nucleoside reverse transcriptase inhibitor. Adults or adolescents more than 30 kg, they can have a combination of tenofovir or plus lamivudine or plus efavirenz. And post-exposure prophylaxis is pseudovidin plus lamivudine plus dolutegravir. These are the various antiretroviral drugs which are at the market. Suppose after passing MBBS, you are working in a casualty and a person with HIV is coming to you with an injury, most probably a cut injury. So what is your attitude? What should be your attitude towards a person who is HIV positive? That person is just like any other patient, but you have to remember 3 P's, which is precaution, protection and prevention, because prevention is always better than cure, and in the case of HIV there are no absolute cure. It is highly imperative that in our field of work, that is as doctors, we will obviously be exposed to one or another kind of pathogen, and in the case of HIV, being exposed to HIV virus is actually a very great critical thing which needs to be combated immediately. So when a healthcare worker comes in contact with potentially infectious body fluids, either due to a stick injury or contact with mucous membrane or contact with non-intact skin, what should be the mode of action? The first thing is, just like Amir Khan said in 3 Idiots, all is well. Never ever panic. The first mantra towards dealing any kind of infection or any kind of patient is never ever panic. And in the case of skin, wash the wound and surroundings with soap or water, rinse well, do not scrub, and do not use any antiseptic or skin wash. And suppose it is a needle stick injury, then there is a provision for post-exposure prophylaxis which can be given within 72 hours. In India, that is recommended for occupational exposure, and it is given for 4 weeks, and the person who is under observation is tested for HIV at a baseline of 6 weeks, 3 months and 6 months. Splash of blood or splash of blood. Suppose if you are trying to put a Ryal screw and the person who is actually suffocating spat on your face and the blood containing the sputum fell on your face and including your eyes, what should you do? Eye irrigation with water or saline is the most critical step after an exposure to pathogen while you're working. If using contact lens, then that should be kept, leave them in place while irrigating. Remove once you have irrigated your eye and remove them and clean them. If accidentally you have ingested the sputum or a fluid which contains the pathogen, then spit the fluid immediately, rinse mouth thoroughly with water or saline. We now know how is HIV being transmitted. But to break this transmission, what should we do? The first and foremost thing is use sterile needles, and if the person is a drug abuser, you can have so many ways to reach out. One strong weapon which you have in your hand is your mobile. Being medicos, your private space is actually a public space which proclaims the quality and the necessity of medical education to the layman. Whatever you are posting in your status, in your post, is actually being viewed by so many of your friends who have actually no idea regarding a disease. So whenever you are posting something medical, always recheck it and then post it. So you can reach out to the drug abusers by educating them that never ever share a needle, and also you can always upheld the thought that drug abuse must be combated and must be stopped at the earliest time. Avoid direct contact with blood or bodily fluid. How can this be achieved? We all know about the word PPE. After the COVID pandemic, the word PPE is very well known to each and every citizen of India. And as far as a healthcare worker is concerned, we can have gloves, protective clothing, mask, eye protection, and also face shield. Ideally, you are expected to use 2 gloves when you are dealing with an HIV positive individual to ensure the safety at utmost level. Educate individuals on HIV transmission and help them to break the chain of transmission, and also educate them in ways to prevent the transmission. Practice safe sex practices. Screening of the donors is very integral as far as multiple transmissions are concerned. And as you know, HIV can be transmitted from the mother to a fetus or a child. In order to prevent that, we can give CD4. If the CD4 plus T cell count is less than or equal to 200, you can give the medicine at 40 to 34 weeks of gestation, IV drug during labor and also during delivery. And the infant, after due screening for 6 weeks, the antiretroviral therapy is given. With this, we can achieve a decreased transmission of HIV by 67.5%, which is very integral in the transmission of HIV. And as I've already told you, the woods are lovely, dark and deep, but I have promises to keep and miles to go before I sleep. As noted by Robert Frost, as a medical professional, we are all obliged and also committed to the thought of all those people who are suffering with HIV. And this 35th World AIDS Day, we urge you to remember and commit, as the motto says, to remember all those people who are suffering with HIV and also uphold the commitment we have for the mankind, because service to mankind is service to God. Manava Seva, Manava Seva, Manava Seva. Thank you.